Hi, my name is Christine Bowen, and this presentation is for Aspen University, and it's my psychopharmacology course, and this is on noncompliance. The general definition of medication noncompliance is patients that do not take their drugs regularly or not at all. For example, patients on psychotic medications commonly refuse to take their meds or hide it between their cheek and teeth and discard a bit later. This is why orally disintegrating tablets are ideal for assuring patient compliance because the entire dose dissolves quickly in the mouth. There are a few reasons for intentional noncompliance that go outside of just psychotic medications. One reason that someone purposely would refuse to take their meds is because of the side effects that they have had or the potential side effects they may have. Another reason is cost. Working in a pharmacy, I have witnessed this a lot with name brand medications and insulins. Even with discount cards from manufacturers, the medication can be too costly. If someone does not fully understand the importance of taking their medications regularly, they may not take it as they should. And the nature of the side effects and the time that it takes to see results is another couple of reasons someone may not be compliant. Looking at the elderly or obese patients with a lot of illnesses, they may have a lot of medications to take, and that can hinder taking the medications as they should be taken. Lack of symptoms, becoming dependent on the medication, and depression are also reasons someone may not be compliant. The last reason I can show support on medication noncompliance is a patient may mistrust their prescriber's motivations for prescribing the certain medications in the first place. And there are certain risks involved with noncompliance, and those vary depending on what the medication is. If it is a blood pressure medication, there are risks of running high blood pressure and other more serious cardiovascular disease. If the medication is for controlling type 2 diabetes, there can be complications with renal failure and other organs. My brother, he has type 1 diabetes and has to deal with serious neuropathy in his feet, and he just had a recent complication with his eyes. He actually has to have surgery in a couple of days because he's temporarily blind. And the list can go on with medications that are proven to lessen severe symptoms. And based on the reasons that patients typically have for reasons of noncompliance, there can be assumptions on how to strategically help the patient be more compliant. One instance is the obvious patient education. If the prescriber is not successful at this, the pharmacy can always counsel. And they have medication separators so that patients can see what medications they need to take each day. And with counseling, the pharmacy is required to give out handouts on the different side effects that the medications have as well. The pharmacy and prescriber should work together to give the best cost to the patient. And that is it. Thank you.